Hey, good morning, ladies and gentlemen. Today we're going to be answering some questions that we received online from some of you. One of the questions was, could you outline the main HT myths? Because there are so many online. So I did prepare a small spiel about this just to sort of give you a small taster into what sort of myths exist out there, and using my anecdotal practice over the last decade. So the first thing is that once you obtain a hair transplant, the results will be permanent. The grafts that we transplant, they will most likely be permanent if they're coming from a donor region which is insensitive to the underlying condition. The second point that somebody asked me to cover is, are the results instant if you have a wedding or a graduation that you're aiming for in 3 months? The answer is no. Hair transplant surgery is not like getting a facelift or liposuction where you'll see, the bulk of the results in, 6-7 weeks. To give you an idea as things progress. With hair transplant surgery, an understanding of the biology of the hair follicle and the way it replenishes using its triphasic nature is very, very important. So results are slow and gradual over a period of 6 months to 2 years. I think actually in some ways this is a better outcome for many men, rather than going back to work in 6 weeks and thinking, ta-ra, what happened to you? So it's actually a little bit more nicer and elegant with the results. Can anyone get a hair transplant? The short answer is no, not anyone can get a hair transplant. Go and see a qualified surgeon who has lots of experience. Go and speak to your own physician first to ensure there are, no underlying medical conditions. And then go and get an assessment. Everyone's different depending on your donor supply, whereabouts you are in the evolution of your journey, and what the cause is. So go and get an individual opinion first. Another myth is it's very painful. Obviously, there's a large variance in patients and how they feel, but on average and usually it's not a very painful procedure. It's done under local anesthesia. Once we anesthetize you, you're actually completely numb. It feels like you're wearing a helmet. You may feel pressure, but there is no pain. You can have some mild discomfort for a couple of days afterwards, but I would not describe this procedure as painful, generically speaking. Another point was, a myth is transplanting as many grafts in one surgery is better than 2 smaller surgeries spread out, or 2 smaller surgeries over a week. That's a complete and utter myth. There's a lack of understanding in the fact that once these hair follicles come out, that's the easy part, but then the clock's ticking. Out of body time is critical for graft survival. If you take out 4,000 grafts in one go, and then you're putting them all back in, your staff are going to feel very pressured to get them all back in one sitting. And I think, and absolutely I will, argue with anyone until they're blue in the face. It's very, very difficult to get all 4,000 grafts in one sitting without fatiguing out your staff. And ultimately, it's them who are going to be handling the grafts and making sure that each of them survive. And secondly, the outer body time, once the clock's ticking, that really, really makes a huge difference. So in my clinic, I will occasionally do a surgery with 3,000 grafts, sometimes a little bit over, but this is the exception. We usually have a cutoff where we want to do a moderate amount, and if it's more than that, we'll do it over 2 to 3 sittings. Or we'll plan it, for example, we'll do one area, and then we'll bring them back in 2 years for the next area. So it's always important to think about this. The results are temporary. Well, if it's done using a properly planned out procedure, talking about the overall problem, they will last a long time. Of course, we're all going to age. Even the best cells in our body are going to age, so nothing is forever. But usually once I do surgery, I want my patients to get a long time out of them. Hair transplant surgeries are only for men. No, they are not. They are for women as well. And finally, there's lots of misconception around FUT surgery is better than FUE or vice versa. Incorrect. Everyone's different. In my practice, the results from both surgeries are the same in terms of quality, growth. It really depends on surgical planning, how the patient feels, how they're going to wear their hair, and this is something to be discussed on a case by case. Hope that clears up some misconceptions. Thanks for your time.